Doctalk Show.
Sickle cell is a genetic disease. This means these are diseases that are passed from your parents through components that are called genes. So I want to know exactly if there might be any problem when you acquire two sets of genes from your parents and both are defective and cause a disease called sickle cell anemia. So maybe I'll start with you, Dr. Deogratius. We have emphasized the disease is genetic. Is there any way, how would the disease then be transmitted to another person?
So with sickle cell anemia, being genetic, just to emphasize the point, is that the mother and the father contribute equally for the child to have sickle cell disease. And we talked about the term carrier, which means the mother has one S with a normal A, and the father has one S with a normal A.
So what do those mean, the S and the A?
So when you have AS, that is the form of the carrier knot. When you have SS, then you have the form of the disease. And when you look at this disease, when you have AS versus SS, AS meaning the carrier form and SS meaning the disease. So you find that the parents are AS and the child is SS. And that is the mode in which the transmission is done. And also to emphasize that you have a 25% opportunity or chance to get this disease because every pregnancy that is formed means that you have an equal opportunity to either get the disease, to become a carrier, or to be a normal child.
So it isn't 100% that a child will get the sickle cell disease if their parents are carriers?
That is correct. Okay. So as I was trying to explain earlier, you have a 25% chance on each pregnancy to have a child with sickle cell disease. And I need to emphasize on each, because when we explain the genetics to parents, they say if I have 4 children, then 1 out of 4 should be sickle cell, and all the other 3 should be either carriers or normal. So they go on and have 4 children, and they come to the clinic after the 4th child, and all the 4 have sickle cell disease.
So it was unfortunate that they happened to fall in the 25%.
So each pregnancy, it's 25%.
Okay. Are there some tell signs that someone might have sickle cell, like some signs or symptoms?
One of the earliest signs or symptoms, how somebody may think about sickle cell, other than having heard about sickle cell in the family, because that's also equally important.
If there's
family history, in other words, one of your relatives on either side has had sickle cell, it may be possible that you may be carrying that gene. Because remember, we said it hides if it is a single, if it is one. It only manifests when there are 2. The disease only manifests when there are 2 genes. Okay? So the first thing is to ask about on either side whether there is any element, family history of sickle cell anemia. That may be the first point to make you think about possibility of sickle cell. But now coming to the child, one of the first signs is they tend to swell on the hands and feet. It's called the hand and foot syndrome, without having been injured or hurt. Actually, most mothers, when they come home, assuming they had helpers at home, when they come back home, they find their children yelling in pain with swollen hand. The first thing is to think about the child having been injured or hurt.
Beaten by the
housemaid or things like that, or falling.
So they just start swelling on their own.
Exactly. Okay. So hand and foot syndrome is the commonest and usually occurs after 6 months of age. It may occur between 6 months and a year of age, usually. So that should prompt in addition to the history, family history, should make you think about sickle cell in particular. But then the other commoner way children present to us is they have pain in different parts of the body. And I think we shall talk more about that. Pain in different parts of the body without actually having been injured or hurt. The other way is that they may also present with yellow eyes, okay, occasional on and off, without necessarily being very sick, okay. And then they may also, usually their growth rate is slower than other children. So you may find this child who's really not measuring up to the other peers as far as age is concerned. And then if you add a lot of these things, then you may actually suspect. The other thing is that when they usually are pale, but they get easily pale, especially if they get any infection like malaria or any other infection.
When you talk of being pale,
yes.
what do you mean by that?
So
because we are naturally dark-skinned
yes.
people, so I don't understand what do you mean by
so
being pale?
One of the easier way one would tell is if you've grown up with your child, you know the normal color or complexity of your skin complexion of your child, and then this one day you realize, hey, my child is lightening up, okay? And when you look under on the skin fold and below the eye, you may actually, in the eye, it's called the conjunctiva, but when you look into the eye, on the inner part of the lower eyelid, you may actually tell, especially if it is very pale.
Like
because normally
it's
it should
not
be
a nicely pink color,
yes.
It's becoming almost white.
Perfect.
Okay, so Dr. Deogratius, well, if the parent thinks the child fits that profile, what should they do in that case?
So thank you for the question. So in terms of knowing that the child has sickle cell disease, we actually can only confirm by doing a blood test. So we usually take off a blood sample and we do a diagnostic workup. The simplest one that can be done in any peripheral unit within Uganda is what we call the sickling test. So they put the sample of the blood into a reagent, which is just a chemical, and it becomes a bit firm, or it agglutinates. Thereby, it gives you an idea that this child either has the gene present, one gene, or has two genes, which is SS. Okay. Now, once that is done, a confirmatory test can be done at higher level laboratories. In our health centers, we have different levels. So we can mainly do this test at either a national referral reference lab or at a national referral hospital lab. So that is where the test is done. And we call this test a confirmatory test, and it's called an electrophoresis.
After the break, we'll come and discuss more about what next if your child indeed has sickle cell. Is it the end of the road? Is there a treatment available for this disease? Send in your questions and comments on our social media platforms, on Facebook, on Twitter. Always happy to hear from you. Don't go away.
You are watching the Doctalk Show.